What are the reasons for a bladder biopsy? A bladder biopsy is a procedure where a small piece of tissue is taken from the bladder for testing. It helps doctors understand what's happening inside the bladder, especially when symptoms or tests suggest something unusual. One of the main reasons for a biopsy is to check for bladder cancer. If someone has blood in their urine, frequent urination, pain while urinating, or lower back pain, a biopsy can help confirm if these signs are caused by cancer. It is also used when imaging tests like ultrasounds, CT scans, or MRI show a suspicious growth or lesion in the bladder. Since imaging alone cannot tell if a growth is cancerous or benign, a biopsy provides a definitive answer. Another common reason is to evaluate abnormal findings seen during cystoscopy, a procedure where a thin tube with a camera is inserted into the bladder. If the doctor notices red patches, unusual bumps, or other irregularities, a biopsy can help determine if these are signs of early bladder cancer or other conditions. Red patches in the bladder lining might be carcinoma in situ, a flat form of bladder cancer, or they could be caused by inflammation. Biopsies are essential in distinguishing these conditions. Sometimes, doctors need to differentiate between an infection and a tumor. If the bladder shows signs of inflammation or growths, a biopsy can clarify whether it's an infection or a malignancy, guiding the right treatment. Biopsies are also used to diagnose rare bladder conditions like interstitial cystitis or infections such as schistosomiasis, especially when symptoms persist despite treatment. In cases where symptoms like pain, urgency, or difficulty urinating do not improve with initial tests, a biopsy may be necessary to rule out serious diseases. It helps provide a clear diagnosis when other tests do not give enough information. Typically, a bladder biopsy is performed during cystoscopy. During this procedure, a doctor inserts a thin tube with a camera into the bladder and looks for abnormal areas. They can then take small tissue samples safely. Before the procedure, patients are usually advised to stop blood-thinning medications, inform their doctor about allergies and current medicines, and sometimes fast to reduce risks. Overall, a bladder biopsy is a vital tool for diagnosing bladder conditions accurately. It helps distinguish between benign and malignant issues, ensuring patients receive the most appropriate care. If you or someone you know is facing symptoms or tests that suggest bladder problems, it's important to discuss with a healthcare professional to determine if a biopsy is needed. Remember, each person's situation is unique, and medical decisions should always be made with professional guidance.